Hello, everyone. Welcome to Living Better with DM, Tools and Services of Occupational Therapy and Home Health. My name is Lucy Schiffman, and if we haven't had the pleasure to meet, I'm the Senior Manager of Community Engagement for the Myotonic Dystrophy Foundation. This session will run for 1 hour. I would love to introduce our two speakers. First, I'll introduce Wendy Schell, who is a senior physical therapist and research education specialist at Houston Methodist Hospital in Houston, Texas. Ms. Schell graduated from Auburn University in 1994 with a BS in biological sciences and psychology, and from Georgia State in 1996 with a BS in physical therapy. She continued her education by later completing a post-professional advanced master's in physical therapy at Texas Women's University in Houston in 2007, and later a doctor of physical therapy at the University of Texas Medical Branch in Galveston, Texas in 2017. Ms. Schell has worked at Houston Methodist Hospital for 24 years, specializing in care for individuals with neurological involvement in the neuro ICU, neurology, neurosurgical services lines, and the HMH outpatient neuromuscular settings, including the ALS clinic and the MD clinic. Ms. Schell has presented at the APTA CSM conference in New Orleans, the ALS conference in Fort Worth, and the DM conference in Houston last year. In addition, Ms. Schell teaches anatomy as a part-time professor at Rice University in Houston, Texas. Secondly, I would also like to introduce Pamela Glazener, who is an occupational therapist and research education specialist at Houston Methodist Hospital in Houston. In 1988, Ms. Glazener graduated from Texas Lutheran University with a bachelor's in psychology and from Texas Women's University in 1991 with a master's in occupational therapy, and also received her ATP certification in 2016. She has worked at Houston Methodist Hospital for 32 years, specifically in the ALS clinic for 27 years and the DM clinic since 2009. Ms. Glazener has presented at the DM conference in Houston, our MDF regional conference last year, the TOTA conference in 2013 and 2023, the International Seating Symposium, Oceanic Seating Symposium in New Zealand and Australia, and the ALS conference. Please join me in giving a warm welcome to our two presenters.
So I'm Pam, I'm the occupational therapist, and I'm going to get our presentation started. I'm happy you all came. Today, we are going to discuss home health, physical and occupational therapy in the home. It varies state to state. The Medicare and Medicaid and insurance rules vary state to state. So what we're going to present is pretty generic across all state lines. Would you say? Yeah. There is a misconception on what home health does. So I want to talk about misconceptions first. A lot of therapists will go in and you will think waist up is occupational therapy, waist down is physical therapy. Have y'all ever seen this before? You've heard it. Okay. That is a misconception. A therapist should be able to treat you from head to toe. It's a very holistic, a very whole body treatment. So today, hopefully you will leave here understanding what you should expect out of your home health therapy sessions, okay? So the focus of home health is on quality of life. Everything they do when they come in your home should be focused on making your life better, all right? That's why they're there. This can focus on your independence. If you're struggling with a task, they need to find a way for you to be independent again in that task. It can be making your home environment safe. And we're going to go over a lot of examples today, how to inexpensively make your home environment safer. Insurance doesn't pay for all the modifications. A lot of what we'll discuss is out of pocket. So we think outside the box and we're like, how can we make things better in a very cost-effective way? We will talk about equipment today, a lot of equipment. How to modify things that do make a difference. I have a lot of pictures about the samples, so I'll explain them to y'all. Self-care should always be in your treatment plan. Mobility should be in your treatment plan, and exercise should be in your treatment plan. Those are three basics. I tell, and I think Wendy tells her folks too, you always, when you're going to get a home health order, start writing down what your problems are. Start writing down what you want to accomplish during your sessions and hand it to that therapist when they come in. It'll guide them in what they're going to do with you while they're in your home. Okay. So you have a say in what your treatment plan is. Like I said, we're going to go through a few of these modifications. We're going to take it down from tasks. I'm curious if some of the people in here have done some of this yet in their lives. Everything I'm going to present is very subtle adaptations. I know people don't want to say, hey, look at me. I'm doing something a little bit different here. What I'm suggesting is very minor, but it makes a huge impact on your life. Okay. And it is inexpensive. So starting with feeding, everyone with the myotonic hands, feeding's an issue. Holding a utensil is very challenging. So the two ways we change things in the home is make items bigger, lighter weight, or into a lever system. Okay. You do one of those three things and you've made a big difference in your task. This is Amazon. It comes tubes, different size holes. You cut them in the lengths you want. You can put your knives in there, your forks. You can put everything you want in these little tubes. They are so much easier to hold on to than a thin utensil. You can buy built up utensils, but this is a much more inexpensive way to do it. And you can put your pens, your makeup brushes, your razors, your utensil. You put anything you want in these little tubes, and they all come in different sizes. $8. Okay. So that's one way to enlarge your objects. The object is to make it bigger. So you're using your bigger muscles and not your smaller muscles. All right. Because the smaller muscles are getting locked on you. So anything we can do to use the bigger muscles. Grooming, same concept. Electric toothbrushes, the best invention. Again, enlarging. You can buy extended handles. So if you're having that upper extremity weakness, you can actually get your arm up, do your own hair, scrub your back with an extended handle. These are all community projects, are all very inexpensive. Amazon's going to be your best friend. Dressing is a huge issue when it comes to coordination issues. My home remedy, I tell my folks, and they actually really do like this, for a zipper pull, zippers are hard. Get a key ring, go to Hobby Lobby or wherever, get a bag of key rings. You put that key ring in your zipper pull. Now you have to just hook your finger in the circle. You don't have to pinch anymore. Problem solved. You can do your own zipper. Some people use a paper clip. Some people use fishing line so you can't see it. There's lots, anything you can do to make a loop is going to make you have a key ring. And for your zipper, button hooks takes coordination. I'm not a big fan of the button hooks, but Velcro works really well. If you have a sewer, put a little tab of Velcro, put the button, Velcro all your buttons down. It's easy. I do have a lot of people have been going to Velcro pants. You never know it's there, but the seams are Velcroed. It's a very simple alteration, and it makes a world of difference for my folks that are having trouble with getting dressed. Okay. There's also a wife-created magnetic clothes that are out there. You get the clothes are closed, and it just fastens right up for you. So if your clothing is an issue, there is a way to fix that problem pretty inexpensively. A lot of my folks at home still love to cook, but bottles, jars, cutting things, it's just very difficult. So again, we're going to use your whole arm, not your fine motor skills. Doing this versus putting even a socket wrench fits, and using your arms are working well. Fingers, not so much. So find a way to use your whole arm to open things. Electric bottle openers, electric jar openers. The community and the products are there. You just have to find them. I did find some really great scissors. These are not, the grip is okay. It's the release, and these release the scissors for you. They're on the market too now. So it's the opposite of what we usually see. I want to point out the Dyson. Has anyone in here heard of Dyson? This is a material that comes in a roll. You cut a strip of it, and it's magical. It sticks to itself. You wrap it around your coffee mug, around your utensils, around your fountain pen, anything you can't hold on to, even your light switches. Your finger sticks on it, and now you can do the task. It's amazing. You can get a roll for $25 and wrap it around everything you can't hold on to, and it really works. It is a very inexpensive, super simple fix. See, this is a picture of it. This is Dyson. It comes in all different colors, but you cut a strip, an inch strip, and just wrap it. I have a lot of people wrap it around doorknobs, and now their hands stick to the doorknobs and they can open and close the door easier. That, or they get these little rubber, because we have a lot of people who rent apartments and homes in our area and they can't make permanent changes. This is a temporary change. This is removable. Now you have a lever, you're using your whole arm to get in and out of your home. And same thing with key turners, enlarging the object. When it comes to the bathroom, this is where the money, insurance doesn't pay for bathroom modifications. Neither does Medicare. You step into the threshold of your bathroom and all costs, it's on you. Some Medicaids do, and it depends what state you live in, but not Medicare and insurance for the most part. So this is very simple, inexpensive ways to fix your home. Everything I think I have listed is under $80. Getting in your tub, it's the number one place you can fall. That step is huge. So you want to be able to sit and scoot over. These tub benches now have these really nice slider seats on them. They rotate, so you can actually sit, swing it around, and slide it in. They're great. So this is a very safe way. This is something your home health people can work on you with. What's the best device for you in your home to self-purchase on your own? Same thing with the Versa frame. A lot of people can get the bedside commodes. A lot of people don't like them. This is, and if you're renting, you can't put a permanent grab bar in your home. This attaches to the toilet. It's like having arms on a chair. They're adjustable in height, so you can push up. So this is a really good solution if you're in a rental. And this is something your home health therapist can decide if it would work for you or not. And same thing with the rubber threshold ramps. They're not permanent. You lay them down, they're solid. These will hold the 400-pound power chairs. They're really good. They go up to 5 inches. These are very simple ways to modify and make your home safe. This is what your home health therapist should be figuring out for you in your home. Okay. The shower stalls are a little bit more complicated. I've worked really hard with some of my patients trying to figure out the easiest way to fix the shower stalls, because again, hard surfaces, slippery, you don't have your AFOs on. This is dangerous. This is where the falls are going on. So one option is to raise your floor of your shower up to equal the height of your step. This is a little bit more costly. You can create something on your own. Prefabricated showers is the inexpensive way to actually replace like a tub. They're prefabricated. The most common I know of is Freedom showers. You pop your tub out and pop your roll-in shower in. I'd say, I think somebody I just had done said it was about $3,000, cheaper than remodeling though. And then this is the real inexpensive way. It's a ramp in and out of your shower. So there is a way you can use a shower chair and you literally ramp up and ramp down, or with your walker. So they make these for the shower. If y'all didn't know, you just measure the step going in. So again, home health, this is what they should be working on. Okay. Making your home accessible. And we're going to go into walking, and then we're going to talk a little bit about wheelchairs and exercise.
I'm Wendy Schell. I'm the physical therapist of this duo. I work more on things of getting around. So getting in and out of bed, standing, walking, a lot of the gross motor tasks, balance, etc. So I'm going to go over some different types of equipment that would help you be mobile in your home setting or in the community. So first, let's look at why do we recommend equipment? First of all, we want you to be independent and mobile, but we want to prevent injuries and falls with that. We want to improve your balance. So it's not that a lot of people don't want to use a piece of equipment because then people see that they're using the piece of equipment. But if we can prevent falls, prevent injuries, and normalize that gait pattern, then that's going to be more normal than tripping and falling and walking in an awkward pattern. So we may recommend a walker, we may recommend a cane. Instead of a cane, you may see people try a walking staff or a walking stick. That doesn't look as much like a piece of medical equipment as a cane. But the whole point is to improve the balance, make the gait look more normal, be more efficient with the number of steps that are taken so that we're not wasting a lot of energy as we're trying to move about. When you use a lot of energy, then you get more fatigued quickly. So we're trying to economize our use of energy to be more efficient moving about. Sometimes having to use more energy limits someone's ability to go a longer distance. So with the use of equipment, we can be more accessible into the community. A lot of patients have equipment that they only use in the community. Maybe in the house, it's not necessary. So Pam and I always say there's a time and a place for what we recommend. Doesn't mean you have to use it all the time, no matter what that piece of equipment is. So there are situations where it might not be necessary, but then there may be situations where that's the best choice, is to have that piece of equipment for that certain setting or situation. So I mentioned walkers and canes, walking staffs, etc. Let's look at ankle braces. There are various versions on the market. I'm starting with the more expensive brands. So these can be in the upward hundreds or even into the 4 digits. So this style right here is a custom style where a cast is made of the individual's leg. And then when that cast is removed, they make a custom mold of that, and it will only fit that person and fit the contours of that person's limb. This one right here is just as expensive, if not more expensive. It's an off-the-shelf version, but it's very lightweight. It fits in a variety of shoes, and it gives a lot of stability. And people are more likely to wear something that fits in a more variety of shoes that's lightweight and not as bulky. The whole point of ankle braces is to stabilize the foot and the ankle so that when you take a step and get to that point where you're on the one leg, that it's stable. But it's also going to help lift the foot and the ankle so that there's less likelihood of falling and tripping. So by giving stability of the ankle and the knee, and then lifting that foot during the swing part of gait so that there's less likelihood of tripping or falling, it actually makes the gait pattern more normal. By normalizing the gait pattern, we prevent falls. We're more efficient in our movement patterns, so we're not using as much energy. And you're not compensating with other muscles to get those legs forward one after another. So one thing that happens with compensation is other muscles are used in a manner in which they're not supposed to be used. The way we're designed, we move very efficiently. And when we start compensating with other muscles, then we're using extra energy, using extra muscles, and then we start to have a lot of pain and discomfort, especially like hip and low back pain. So the more we can make the gait pattern normal, then the more we can be efficient and the more we can cut down on possible overuse or pain from using muscles in the way that we're not intended to use. So I wanted to show a few economical options for that ankle brace. Most of these are under $45. You can find them online. So the previous ones I was showing you were on the more expensive end. So this one right here is a cuff that goes around the ankle, and then it attaches into the shoe and to the laces and gives that lift there. This one is onto the front of the leg and then Velcros around the ankle and to the foot. This last one is more of a sports type support. You can find it in the sports section or the bracing section of a sporting goods store. It makes your shoe look like a high top, but it gives some support around the ankle and the forefoot to give stability of the ankle and a little bit of lift. If we were to compare these to the others, sure, the ones that I showed you first are more expensive and they're probably going to do a little bit of a better job. But if we're trying to be economical with our funds, this might be an opportunity to still get a little bit of the same lift and safety feature without having to go the 9 yards. Pam's going to talk about wheelchairs.
So I wanted to very briefly talk about wheelchairs. You have many options when it comes to wheelchairs. There is definitely a process to it when insurance is involved. It is getting more difficult to get more complex equipment. Sorry. So things to remember. Insurance only covers one chair every 5 years. So whatever you get needs to meet your needs for 5 years. The pediatric chairs grow, adults chairs grow a little bit, not a lot. So, for example, this is not a Medicare chair. This is a transport chair. Amazon carries it. Walmart carries it. It's about $80. If you need something to throw in your car for just appointments and you have good balance, this is a great option. It's lightweight. It weighs 12 pounds. It's a good way to go. These three can be covered by insurance. Okay. If you choose to do a manual chair through insurance, the power, unless something medically changes, is going to be much harder to get within those 5 years. So just know that in the back of your mind. This is a self-propulsion chair. You can get it ultra lightweight. You can get it fancy. You can get custom seating. There's a lot we can do with it, this and Tilton Space chairs. But again, 5 years. These two are a little bit more thought process needs to go into them. You need to think about accessibility. You need to think about how are you going to get it in your home? How are you going to get it in your car? Is your home accessible? Your doors need to be 30 inches minimum. All these chairs, the base is only 24 inches. So these are actually narrower than this because the wheels are underneath you. But these two cost $3,000 approximately to $22,000 approximately. So a lot of thought goes into this with insurance. The physician becomes involved. You have to get a seating assessment. Your vendor has to be involved, and everyone needs to match. And then they go and fight insurance for you. Medicare covers 80% of these chairs. If you have a secondary, it's usually pretty good coverage. But everyone's insurance is different. Medicaid is different everywhere. So you have to know what your coverage is and just reach out to your OT or PT if you are needing power mobility. Okay. Some homes, stairs are a big issue. Transporting this is a little bit easier. This will fit on the back of a car on one of those lifts because it only weighs about 180 pounds. This one weighs 400 pounds. This one doesn't go on the lift on the back of your car. This one requires a van or a taxi Uber or some kind of modified vehicle. The other difference, this one, you can go up and down in it and you may be able to get tilt, but your joystick is how it comes. There's no programming. There's no other way to drive that chair besides your joystick. And it has a captain seat. This one, if you qualify, programming, you can drive with your head, your knees, whatever moves. This one has all the seat functions, tilts, lifts, reclines, goes up, lifts you. There's pros and cons to everything. So I guess the take home message is when you're getting that therapist in your home and you need a wheelchair, say, okay, let's have a really good discussion about this. Which chair are you talking about? And make sure you make a very educated, knowledgeable, and know all your option choice when you make that decision. That's sort of the take home message about wheelchairs.
So that covers all of the equipment that the therapist coming into your home could possibly recommend. I'm sure there are other possible modifications, but from a gross overview, those are the types of equipment that we would recommend. Let's look at just general activity. So one of the goals of therapy should be fall prevention or safety in general. So to be safe, we want to prevent falls, and that might mean recommending equipment, but it might also mean modifying your home or just changing the way you do a few things. So might you have something to hold on to getting in and out of the shower or around the commode in the bathroom? Pam mentioned earlier how dangerous the shower is. Think about just the bathroom in general. It's a bad combination of things like hard surfaces, sharp corners, and a lot of water. So if you're going to fall, that's really not the place to do it because there's nothing soft to land on, a lot of sharp surfaces, a lot of water. So grab bars are a really good idea to have in an area where it's high risk. Things like making sure your pathways are clear of any clutter, whether that's magazines, the dog sleeping, kids' toys, grandkids' toys, etc. That the main pathways that you're going through are free of any clutter or tripping hazards. Think about any spills or tracked water that would need to be gotten up so that we don't slide. Removing any mats or rugs that you might catch your toe on and roll it up. The best thing is to get rid of all the mats as much as possible, especially the ones that don't move. The ones that have rubber on the bottom, or you could use a two-sided adhesive to keep them in place, would be better than the ones that would slide out or roll up on themselves. Making sure that there's adequate lighting, that you can see where you need to go at all times. Do you have a night light? Is your lighting accessible? Can you reach it? Is it bright enough at all times or various points of the day? Making sure that footwear is appropriate and fits well. A lot of people don't wear shoes in their house, but even outside, or even if you're wearing shoes in the home, making sure that they're not flopping up and down or that they're too big. Shoes that are more from a flip-flop nature or a sandal nature don't give you as much support and don't stay on as well. It takes more effort to keep them on. So if someone is very unsteady, there's not a really good choice of footwear to wear. Think about taking your time and not rushing. If it's trying to get to the bathroom, maybe go a little more frequently during the day instead of waiting until it's too late and there's a rush. You've got to get there and get the clothes adjusted before it's too late. So trying to give yourself more time and not rushing. So those are all some examples of preventing falls and making home a safe place. Let's look at some components of exercise. So we have exercise goals, we have exercise precautions, and we have some exercise guidelines to share. So when you talk about exercise, I think a lot of people think that you have to go to the gym and be pumping iron like Mr. Universe and get on all this equipment and make it really fancy, and that the goal is to be really bulked up, and that's not true. So when we think about goals for the DM population, we want to think about just maintaining fitness. If you sit and you don't move, then your muscles just get weaker. So we're just trying to encourage activity and use of your muscles so that we can try and maintain some of the strength that you have. So we're trying to promote a healthy lifestyle and maintain some strength. Another goal would be to maintain some mobility. The more you sit, the less you move, the less endurance you have, the less strength you have. It's just harder to get around. So maintaining mobility, as well as maintaining flexibility and maintaining strength. We also want to prevent falls. And Carolyn also mentioned in her talk earlier today, if you came to the talk on nutrition and swallowing, about being up and moving helps clear the airway. And so I was happy to hear her say that, because I had it as part of my slide too, that the more you're up and moving, the easier it's going to be to clear your airway and clear those secretions. Believe it or not, the more active you are, the better of a sleep-wake cycle that you get into. So you sleep better, and then therefore you're more awake and ready to go and active during the day. So a little bit of exercise goes a long way in helping with that daily alertness and having a better quality sleep. Let's talk about some precautions, because for the DM population, there's some things that we need to consider, especially from a cardiac perspective. So what I want you to think about is that strengthening is not a goal. We're not trying to build muscle. We're not trying to bulk up and have big, highly developed muscles. So we're going to have to think about it outside the box. We want to maintain strength. So that means we want to use your muscles, but we don't want to use your muscles in a way that's going to damage the muscles. Another precaution is we want to limit fatigue. So if you're really tired after exercising, then maybe we did too much, maybe we did the wrong activity, but we want to keep it reined in on your level of energy and not over fatiguing because there was too much exercise done. While you're exercising, we want to keep an eye on your breathing. Are you getting short of breath? Is it getting harder to breathe? Catch your breath? Then that's too much. So we don't want shortness of breath with exercise. I mentioned briefly that we don't want your muscles to become weaker. We don't want them to be sore. So if you try to overdo it and do too much from an endurance perspective or too much from a lifting perspective, we may actually cause muscle damage, and then the muscles will become weaker as a result. So we don't want your muscles to be sore. That can be a guideline for you too. And when you do exercise, how did you feel? Were you sore the next day? If you were, you might have done a little too much. One thing to think about from a heart perspective is many times you may hear people say, I achieved a such and such heart rate, and that they got their heart rate up to a certain range during an exercise activity. That is not a goal that we're going for with this population because of the background of the cardiac condition that may be underlying. So don't use a certain range of heart rate as a target to work up towards. And before implementing any exercise program, I highly recommend with our patients that we consult with the cardiologist because each person is different and their cardiac condition needs to be evaluated before implementing an exercise program. Really take these precautions in mind and check with your cardiologist before implementing that. So let's look at some recommendations. Choose something that you like. If you choose something that you don't like and you're forcing yourself to do it, odds are you're not going to do it. So it's not going to be something you enjoy and it's just going to be drudgery. So pick a task that's enjoyable. You may want to recommend having someone that is a partner or an advocate or someone to keep you on task, maybe an exercise partner so you can do it together. Set a schedule on your calendar, days of the week, times of the week, so that you can make it part of your routine. Because if you keep pushing it back and it's not as important, then it's not going to happen. And eventually it's going to fall off the radar in general. So it's got to become part of your routine. When we're looking at our goals and what we want to accomplish with exercise, we want to keep it low impact. We don't want a lot of pounding on the joints. We don't want to really ramp up the heart rate. We don't want to get a lot of breathing that we can't catch our breath. So we want to keep it rather low impact. Stretching and flexibility is right up your alley. So just trying to maintain the length of the muscles and the tendons to keep that flexibility so you can move through the full range of motion that we are designed to have and that we're not getting contractures is a big goal of exercise for this population. One option may be a walking program that's very low impact. You can do that with a partner. If you're not at risk for falls, if you are at risk for falls, make sure you have the proper equipment that you're using. If you are at a high risk for falls, you may want to consider something seated, like a video or exercise program from this seated position, a bicycle that's in the recumbent position and not climbing up onto a stationary bike or a regular bicycle, a recumbent bike. And that way the risk of falls is removed or lessened. Can you exercise with resistance? You can, but we don't want to try and lift 40, 50 pounds. We want to go with more reps of a very small weight, 2 to 3 pounds, something very lightweight. And being able to control how does that affect your muscles as you implement those repetitions. So if you do low weight, but more reps, you can get a better idea on how that's affecting the underlying muscle function and if that's going to make you sore and get a better feel on, I did too much yesterday, or I could do a little bit more when we have a low weight, but more reps. If you do it the other way and try and lift 50 pounds and you do it 5 times, it might be very delayed, like the next day or in the following of having that soreness, and you might not feel it initially, but it may come into play later of that wasn't the right activity to do. So we've had better luck with low resistance and multiple reps. So let's look at some options that can be implemented in the home, because if the therapist is coming to the house, they're limited with what they have to offer because it's got to fit in their car. So they can't come with a treadmill and a stationary bike and a Stairmaster and all these kinds of things. So let's look at some options that could be used from a therapy intervention in the home. You may have a lot of things around your house that you can use. There are very small pulleys that you can order online that you put them on the back of a door, and then that gives you some stretching with your arms. So as you pull one arm down and you hold on, then the other arm will go up. So that's a good way to get some assisted flexibility. You can use small weighted items in your home, like canned goods, as your 1 to 2 pounds to lift. I think it's 150 pennies, and a sock is about a pound. So that's another home item that you may have access to. You don't have to go out and buy weights at a gym or at an athletic store. I'm sure you've seen the different colors of resistance bands. Depending on the brand, the different colors give different levels of resistance. And so you can cut those and tie them onto a stationary object and pull, or you can take them and pull them apart into different directions. And that is lightweight strengthening there. So that resistance band can be ordered online. Muscle contractions where you're not actually moving the limb, but just contracting the muscle and relaxing it, contracting it and relaxing it without a lot of movement is called isometric muscle contractions. Those still maintain strength. So you might not see a lot of movement or a lot of resistance, but just contracting, holding, and relaxing can help maintain strength. There are some small bicycle pedals devices that are portable that you can sit in a chair and pedal. That's a form of cardiopulmonary exercise to help with heart and lung function there. They're not very expensive and they can be ordered online. Any flexibility is totally fine. Any cardiopulmonary is fine as long as we're not trying to reach a target heart rate and you're not short of breath. Sitting and standing exercises will depend on your balance and risk of falls. Strengthening can be done very light weights, but multiple reps, but limiting muscle soreness. So in summary, it's always disheartening to me when I have a patient who says, yeah, I had home health and all they did is they came out and they did some exercises and they left. And I'm thinking that wasn't at all what we had in mind when we thought that you would be getting home health. And so what I wanted to share with you is that there's a whole lot of options that the therapists have when they come to your home, whether it's recommending equipment, making sure that you're safe in moving around your home by preventing falls, recommending modifications, whether it's adapting things in your home, using proper forms of exercise for you. There's a whole array of things that they should be equipped to assist you with other than just doing some reps of 10 and getting in their car and going to see the next person. So that was the whole point of our talk, is we wanted to impart some wisdom to you so that you have an idea of what they should be capable of doing, but you've got to make it known on what your goals are, what you need to accomplish with them coming to your home. So whatever they do with you needs to be personalized for what your needs are, which means you're going to have to share that and you're going to have to speak up and be an advocate for yourself or for your family member. But these goals need to be functional. They also need to be progressive in that you show improvement and you're able to do things more independently or make adjustments. These goals should help with safety, help you be independent, or they could also be educating and training family members. So we just wanted to equip you with some knowledge and examples of things that therapists coming to the home should be able to offer you or your family member in the future. Thank you.
Questions?
Thank you so much for a very informative talk. I think you mentioned at the beginning of yours, it was about like someone was sending an order for home health. Like, where is it typically coming from? Is it like your doctor's ordering this, or how is that referral happening?
The referral needs to come from the physician.
Okay.
The physical and occupational therapist, I believe speech pathology too. We need a physician's order in order to come into the home. Go ahead.
Speaking of having an order for therapy, I just wanted to clarify that even though a PT and an OT have gone to school and gotten their training and they have their license, every doctor that you see is not a neurologist, right? So every therapist, whether it's PT or OT, is not necessarily a neuromuscular specialist. So when you have that order for therapy, you want to make sure that the person coming into your home is not a therapist who works with athletes for a sports injury recovery. If possible, could the person coming into your home have more of a background in neurology or neuromuscular disorders? And if they don't, then do you have a contact information that therapist could then get in contact with someone on your team so that they can get some background information on some do's and don'ts? Because a lot of what Pam and I just spoke about, we did not learn in school. It's because we work at a specialized center with a large population of DM patients. And a lot of this we've learned along the way over the past 15 years. So just for your expectations, know what questions to ask.
And I will add to that, if I may, if you go on myotonic.org and look at our resources, we do have clinical care guidelines for both occupational therapy and physical therapy that you can share with any of your clinicians or therapists so that they can learn more about DM and how best to help you.
I cannot get up from a normal chair. And whenever I go to like restaurants or what have you, I can't get up and it strains my husband's back, so he can't do it. So what is something that I could use where I can get up from a chair?
Sure. We can help you out.
Help you out.
The principle behind before you ever sit down is to look at the height of your hips compared to the height of your knees. So if your hips are at the same height of your knees or below, we're going to have to call the tow truck. If you're sitting and your hips are higher than your knees, like you're on a bar stool, you're going to pop right up much easier, right? So the higher and the firmer that the seat is that you're sitting on, the easier it's going to be to get up. If there are armrests there, that's going to be easier too. If you go to a restaurant, all you have is what they have, right? So we have found there's a portable cushion called an uplift seat or uplift cushion. It's portable. It's just like a stadium chair or stadium cushion. And you put that in the seat and you sit down and eat your meal or enjoy your movie or whatever it is. And then it has a button on the side and it'll give you like a little oomph to come up. It's like a little miniature catapult to just get you up. It's a portable version of the uplift recliners, but it's portable.
Yeah, it's hydraulic and it's calibrated. Some of them are calibrated to your weight and they'll raise you about 8 inches up off the seat. I saw somebody earlier with one in here. They work great.
So along the same line, will that help you get out of a car and into a car if you can't?
They are only one directional, unfortunately.
Do you have any suggestions? My dad cannot, he can sit into the car, but he can't get his legs pulled up.
Anything you put on top of a car seat, you run the risk when you slam the brakes on, it's going to slide. So you have to be really careful what you do to your vehicles. I have had people put pretty thick cushions in their car seat and put a big amount of Dysum underneath it because it's the non-skid material. And I've had people do that.
Excuse me. Did you mean he can't lift his legs to get into the car?
Or his out of the car.
Or he can't lift his bottom?
It's usually both. Like some reason his right leg, when he's a passenger, he just can't get it up.
There
He
are
has to lift it manually usually.
you still have to lift it manually, but there are leg lift loops that you can put around your legs and like leg lifters to help lift in and out. You're welcome.
Awesome. Please join me in giving a very big thank you to our presenters.